Joining us now is Congresswoman Madeleine Dean, who represents Pennsylvania's 4th District in the southeastern part of the state. Congresswoman, I worked in a White House, and if you really want to thank people in a factory for their vital work of making gowns and masks and things that kept frontline healthcare workers safe, you could set up a Zoom call like the rest of America. What do you think is behind this really not essential travel? And as Brian and I talk about all the time, moving the president requires thousands of people to be in motion.
And putting people at risk. Thank you for having me on today, Nicole. I'm proud to represent this southeastern portion, suburban Philadelphia, where we've been particularly hard hit. So what do I think is behind the president's movements tomorrow to Lehigh Valley, right north of here? Sadly, to me, it looks like a thinly veiled campaign event. His events that are going on at the White House or in the Rose Garden are not going so well for him. He's put forward an incoherent, lacking cohesion policy. He's responsible for deadly denial and deaths, sadly, by deflecting and blaming others. So I think they're just trying to get on the road, take him on the road for a campaign event. As you say, the safer thing to do would be to sincerely thank this manufacturing facility and not put anybody at risk.
Congresswoman, Brian and I start this hour every day with the latest numbers of the infections in this country and the people who've lost their lives. And I know this is much more than a number for you. You have lost a loved one. Tell us what this disease is like and what it does to families.
Well, I want to start with the numbers, too. The gravity of it here in Pennsylvania, we have had nearly 4,000 deaths. I represent Montgomery County and Berks County. In Montgomery County, we have had 556 deaths, and one of those numbers is my own mother-in-law, Joan Canan. In Berks County, another 179 dead. So what does it mean? It means there are heroes taking care of our loved ones as we cannot even be near them. My mother-in-law was taking care of Joan Canan, just a wonderful woman, originally from Scranton, just a wonderful woman who became sick with COVID a little more than 2 weeks ago. The wonderful workers at her very small nursing home, putting themselves at risk for not a lot of pay, kept us in touch, literally did FaceTime calls with us, like I do with my own grandchildren. And then we did a Zoom call with the whole family later as it became very apparent that she was not going to survive. And they moved her to a window near the patio so we could actually go over and see her just a couple of times before she died. They kept her comfortable and at peace. But families like mine and families even in broader, greater ways are suffering. This is not a joke. These are not numbers. When we say 80,000 people in this country have died of COVID in a matter of 8 or 9 weeks, these are human beings. These are families that are disrupted and not able to appropriately be next to their loved one, not able to appropriately mourn or bury their loved one. So I take it very personally, and I call upon the president to stay home, stay out of the way, and pay attention to the guidelines that my governor has put forward, Governor Wolf, and the guidelines of his own team. And let us do our work. We are headed back to D.C. to drive more aid to the people who are suffering, to the people who are suffering the public health crisis, but also the people who are suffering the economic crisis.
Congresswoman, I'm sorry for your loss, and I note your sadness and your anger, and the prediction is we'll be at 100,000 dead, 100,000 souls just vanished by the end of next week. And I tend to believe that most Americans are doing the right thing. Most Americans don't want to get this. It's not so much that they're following an order. They don't want to get this. But I'm wondering where the sadness and the anger is, the type of which you display. If we take, God forbid, 100,000 people, it's like reverse contact tracing. Think of all the lives they affected. Think of all the loved ones they leave behind. You'd think our country would be saddened and angered to the point of demanding the science, the doctors, the scientists to come forward, and let's hear from them and only them.
And you know what, Brian? We do have that. We have powerful, good people, whether it's in the administration here, in the Wolf administration, in my own county government. We're led by a physician. So while we're hard hit, we've had really smart voices on this and eyes on this. Unfortunately, the president has gotten in the way and confused people. A lot of people around here have gone through an awful lot of sacrifice to stay home, to stay in, to do the distancing. We've been told we need to test, isolate, contact trace, and then get toward treatment and blessedly a vaccine. In the meantime, the government has a responsibility to not get in the way of that. And sadly, this president has. But I say, listen to the heroes, listen to the helpers. And to your point, Brian, think of it. 100,000 people plus will have lost their lives. The ripple effect across families, the inability to grieve or be near them is extraordinary. What I want to focus on also is my own work. I'm very fortunate to be a member of Congress at this critical time. We're going back down to Washington, as you know, to pass what is being named the HEROES Act. And I'm proud to be a part of that. Three things that are in that. One reflects some of my concern about nursing homes. These folks are on the front line and they are underpaid and at great risk. They are heroes. They need a pay increase. Another part, a bill that I have proposed, is actually part of the of the HEROES Act that I hope we will pass on Friday. And that will give direct relief to student borrowers, $10,000 worth of direct relief to student borrowers. I also hope we will drive more money to the smallest of businesses so that they can stand our communities back up when it is safe to do so, not prematurely. And also, we need to get more direct cash to individuals, to families, to students, to folks who are simply, through no fault of their own, had their lives and their livelihoods completely disrupted.
We will be monitoring all that, and we hope you'll come back and talk to us about your efforts there. Representative Madeline Dean of Pennsylvania, again, we're so sorry for your loss, and thank you for talking to us about it. Thanks for spending some time with us today.
Thank you both.